At the Royal Free Hospital in North London, they look after dementia patients a little bit differently. The ward here is designed to look like an old seaside resort.
To walk around and look and see things that are familiar to them.
Look like the outside world.
Look like the outside world and trigger pleasant memories.
Yeah.
Every bed is taken here and there's always a lengthy waiting list. Danielle Wild says many patients shouldn't even be here.
We tend to be a bit of a last resort for patients to be brought. In many cases, patients who are brought to hospital don't have a medical reason for being here. They're brought here because there are people here that can look after them. We need to change that.
The problem is the NHS is simply struggling to cope with the number of dementia patients. Nearly 500,000 people now have a diagnosis of the disease. That's up 7% in the last 3 years. It's a massive challenge that has to be dealt with.
Although NHS leaders admit the service is having to run to keep up, they insist there is more care now in the community.
With funding, with around 20,000 new support workers, an army of support workers, I think we are in a very good place to provide the care and treatment close to people's own homes.
But the sheer number of patients means dementia is now the biggest health and social care crisis of our time. This specialist care home in Bristol is having to expand to meet the need.
As the years progress, we are seeing more and more people with higher needs dementia coming to us. We're definitely seeing our homes are full, basically, with waiting lists, with people who have high needs dementia.
With no cure, trying to prevent the condition is the only way to reduce the number of diagnoses. But with an ageing population, many feel it's also time to revolutionise the way we support those with the disease. Emily Morgan, ITV News.